These webinars are made possible thanks to generous donor support. If you'd like to contribute, please visit our website at autism.org. Now, before we get started, I'll introduce our speaker. Mojdeh Mostafavi is a dual-trained internist and pediatrician currently pursuing a pediatric fellowship in gastroenterology at Mass General Hospital for Children. With a profound personal connection to autism through her brother, Dr. Mostafavi's dedication to advancing autism care is driven by her commitment to equitable healthcare and her expertise in integrating behavioral therapy. Her passion lies in providing care across the lifespan, reflecting her belief in how today's actions shape future experiences. Her work exemplifies a deep commitment to enhancing access and quality of care for all individuals, particularly those affected by autism. And now I will turn this over to our speaker.
Thank you so much, Denise, for that wonderful welcome. And thank you all for participating and joining today. So a little bit about myself, you heard, a little bit of my bio. I think one of the things that often comes up for most of the presentations I do is, where did you do your training? What is your training in? And so I have the obligatory CV slide, where you could see, most of my training has been here in the state of Massachusetts. I am currently at Mass General Hospital for Children, but have had the ultimate privilege of training at Bay State Medical Center, Tufts University School of Medicine, and at Smith College. And that's kind of my professional hat. I think equally important, if not more important, and definitely pertinent for today, is the other hat that I wear. And so I love someone with autism. This is my brother. His name is Payam. On the other side of this photo at Disney is my sister, Roya. And today I was asked to talk with the lens and perspective of sibling. And so I'm going to be, in later dates, giving more of the talk from perspective as doctor. I am happy to answer questions about perspective as doctor, but just knowing that there will be additional opportunities with that lens as well. I also give the caveat is you're probably going to see a lot of Disney in these slides. I have not been sponsored by Disney, sadly. If anyone has contact information, please let me know. So with that said, I have no financial disclosures or conflicts of interest in this presented material. The views and opinions expressed here are my own and do not necessarily reflect that of my organization, although I am very happy to have the support of Mass General Brigham. Another important disclosure in this is the fact that words matter. And I'm speaking, I always say preaching to the choir, this is a community that knows this really well. In this presentation, I am going to be using person-first language as it's the preference of my family and how I've grown up. However, I recognize and completely understand that if some individuals prefer identity-first language. In general, if you're unsure, I always tell people to ask, and I certainly don't take offense to identity-first language, just letting you know that I'll be using person-first. So to jump right in, I think the perspective of sibling was a really difficult topic for me to try to figure out how to organize and structure for this webinar, to be completely honest. I am very used to saying, let's think about science, let's think about data, and that has a structure and a format. When someone asks you to tell you your story and your family story, that's a lot more difficult, I would say. And so what I thought I would do is just kind of walk through chronologically some of our experiences first, and then kind of highlight some of the reflections that I had going through this. So we'll have lots of cute baby pictures because we must. So as you see here in your top left of your screen is a picture of my brother. So I am the oldest of 3 kids. So I was about 2 years old when my brother was born, and then about 7 years after me, so 5 years after him, was our sister. When my brother was born, first of all, it was an uncomplicated pregnancy and delivery. They had no problems with me when they had pregnancy and delivery or medical problems. So they really weren't expecting much, my parents. For background and for reference, I think it is important to note that both of my parents are in the health field as well. My mother is a dentist and my father is a urologist. So they both had a lot of medical experience and knowledge. Although I put the caveat that it was in the 90s. And so that looked really different than what it looks like now when we think about things like development and autism. So After what appeared to be an uncomplicated pregnancy and delivery with my brother and an uncomplicated sort of early infant period, again, I have no recollection of this. This is mostly my parents because I was two. They talked a lot about, he was a colicky baby, but not really much stood out. It wasn't until about 18 months where my parents noticed that my brother was experiencing a pretty profound regression. And so at the time, we were both bilingual or learning to be bilingual as small children can be. And what they found was as he was learning a word, he would lose 5. As he learned another word, he suddenly lost 10. When he used to respond to his name being called, he suddenly stopped. And then he stopped making eye contact, and he had a lot of the stereotypies, including like the lining up of toys, the hand flapping, and the sort of finger twisting, ringing. And this was all within about a 5 to 6 week period that all of this regression took place. And for my parents, it was exceptionally jarring. And at the same time, they didn't have a lot of resources or references as to what could be going on. And so it was actually at that stage in time, it was one of his teachers at preschool that said, "I'm really concerned about autism. I think you need to go get evaluated." And again, this is entirely the perspective, shared perspective told to me by my parents because I couldn't remember it, if I'm being honest. Important moments that took place then. So my brother was born in 95, so this would have been in 1996. When he was diagnosed, unfortunately, a lot of the practices at that time are not equivalent to what they are now. And a lot of the language about what to expect in the future was really negative. And so my parents they left the meeting with the diagnosis really feeling disheartened and really feeling alienated, especially when it came to the health field. My mom recalls the story of just, walking away with the message being told that, these are all the things he'll never be able to do. He'll never be able to live independently. He'll never be able to talk because at that point he was completely nonverbal. You have one healthy child, and at the time, what she was told was, you should really consider placement. You're both young, to my parents, and think about having other kids. So it was a really traumatic experience for my parents receiving that diagnosis, and at a time where the general population really didn't, again, this was the mid-90s, so the reported prevalence at that time was about 1 in 10,000, was not something that was commonly recognized, or known, or understood. And so they also had the challenge of within our, extended family and community, trying to understand and explain what was going on. For my parents, what that looked like was really a lot of self-education, was really diving into the literature about what sort of interventions and tools and strategies can be used. And so applied behavioral analysis became a really important part of the household and of our life. So I give this background because, again, all this happened, even though I was there present for it, without my memory or recognition. But it's, I think, an important backstory to kind of think about how I come into the story as well. So my parents live and continue to live in Western Massachusetts, where there really are not a lot of resources. And then especially then, there were not a lot of resources for someone who had as profound needs as my brother. And so what that meant for my parents, who were fortunate enough to have the knowledge and financial resources to do so, was developing a home-based program. So my mom learned and spent an extensive amount of time learning about ABA, learning about behavioral theory, and brought in providers, and at the time, psychologists and, now BCBAs, to help teach us and also help create a program and do tabletop and all these types of things with my brother. So that was the environment that I grew up. In the household, lots of people, OT, SLP, like in my house, providing these therapies as a young child. And that's where I have many more memories, and I'm happy to share and kind of talk about that. And the way in which I was involved actually in these activities was really sentinel to my own sort of growth and development. So that's our, kind of early story of diagnosis, of resources, of, trying to, understand my brother's behaviors and how to support him. So through that time, you can see, some of our young childhood photos. Clearly, we were a handful, the two of us. My brother and I, initially, I was not too keen on having a younger sibling, I was told, but this was, again, little me. But once I really became cognizant and aware of like, oh, I have a brother, he's kind of like a toy, I was very much excited to have a partner in crime. And so we would be always whatever my brother was doing, I would be doing with him. Whatever I was doing, I would drag him along, usually against his will, to come participate. And that was kind of the early childhood years. We really didn't travel much as a family. This picture actually was our first time ever on a family vacation. And that took a lot of work and preparation. And people are always very curious, like, why Disney? But that's because my brother's special interest is Disney. So Disney World is something that will come up a lot in my photos. But basically, it was trying to figure out what would be something that he potentially could enjoy that would be in his special interest and working towards that. So a lot of the early childhood memories are deeply entrenched in this learning new skills, ABA, speech OT, in my home. So then we start to transition, from early childhood, and that's, I think I'm going to come back to this a little bit as well. I think for me, it was probably around age 6, 7, maybe even 8, that I started to recognize that, oh, my home life looks different than my peers. And I don't necessarily think at that time immediately I understood the depth to that, but that's when I started to recognize there are more people in my house than in other people's houses. We have, different just environment and safety padding and things like that than other people's houses. And the when we think about just like the experiences, that was like somewhere in that 6, 7, maybe even 8, where I started to recognize the difference. So then, comes, going through school and getting older. I am 2 years older than him. So as you do, you go through teenagehood and puberty, and boy, is it hard. But for my brother, it was exceptionally hard. And so my brother, he, through all of that intensive work, really was able to develop some limited verbal communication skill. And that fortunately has continued to progress over time. But he has had really limited speech communication. And in adolescence, it was challenging for him because he had a really hard time expressing frustration, verbally expressing his emotions, expressing some of his needs. And that would often lead to behavioral outbursts. And at that time, the primary behavioral outbursts that he had was like aggression. And aggression could involve hair pulling, scratching, biting. And some self-injurious behavior at that time, not a lot, but some. And it was almost always, and again, in this sort of early adolescence, tied around not being able to communicate that would drive, or not being able to have something that he wanted or needed, and then not being able to communicate that. And then once you finally figure out what it was, still not being able to provide that would drive some of these behaviors. And in that period of time, I was the primary recipient of the aggressive behavior, followed by my mother. And I think the thing that was really interesting, has always been kind of interesting, is my brother and I are extraordinarily close, and we've always been very close. And so in that time, he would have these moments where we would have, challenging behaviors, and then he would just be sobbing afterwards, as if recognition of what he had done, or like the fact that I was upset. And it was very challenging, and it was made that much worse by puberty, because the hormonal shifts that we all go through really made it difficult for him to self-regulate. Added to the fact that, again, communication was, or has at that time, was our major barrier. But we made it through, and I think the important parts, and I like to come, and I'm kind of giving you the brief version to go back and with my reflections afterwards. There was a period of time where it was very challenging, and we were very fortunate to have lots of support by his medical team, lots of support by his behavioral team. We were able to maintain him safely in the household. And so really a labor of love, and we were able to kind of get through what was a really challenging moment with a lot of support. Also recognizing that unfortunately, still Western Massachusetts, not a lot of resources outside the home. So there really weren't also additionally many other options to begin with. And then beside that, options that would work with his needs. So throughout adolescence, he still has his loves of Disney, his love of travel to specifically Disney World, and, doing Disney World in a really unique way, small aliquots with the characters, things like that. Loves of his family. He's incredibly affectionate and loves to cuddle and just, my parents sort of would say like 95% of the time, just especially even in these hard moments, 95% of the time was just awesome. It was that 5% where he really struggled with communication that would then result in the behaviors. So then we all continue, to get older. Once we got through puberty, that was just like such a moment. It was a great relief, I think, to all of our parents once the two of us. Sadly for them, they had my younger sister who still had to go through puberty, so that was an adventure, I think, for everyone. But we got older and we still maintained our interests. I very early on was wanting to be a veterinarian and like interested in science. And then for me, there was like a moment where I was like, actually, I think I kind of want to do this science thing and maybe medicine. And so this is us when we were in, high school and college, for me, high school and college, trying to figure out life, what does it look like as an adult, and still very much aware of, the needs of my brother and how they are evolving. And I think the piece that I like to highlight here is, in addition, like all the support people that we've had, again, in the home. So my experience, I think, is a little bit different than a lot of siblings because everything has been completely enmeshed in my life and in my home, whether it be services, whether it be challenging behaviors, whether it be really wonderful, happy moments. And it has created this this just composition of so much complexity that I'm hopefully going to unpack a little bit with you guys in a moment. So here, I think it's important to sort of identify and highlight, the small milestones. Going to things like the movies for a long time was not something we could do. As much as he loved it, he couldn't handle the sensory. And so being able to go and enjoy movies and having headsets. His first haircut at the barber was when he was like 17 years old. Getting his wisdom teeth out was again a labor of love with my parents, really working on desensitizing and supporting him through the process of needing to get medical care. We have here, one of his support people as well, him even tolerating the COVID process that I think we all still shudder to think about. It was a huge win. And then I think, for me, especially, this is my medical school graduation. Never in my life would I have imagined we would be in a position in place that he could come and join me for my graduation. One thing that I didn't put pictures and didn't really want to highlight, or didn't highlight too much here, that's going to come up in my future talks, is, my brother has also experienced really significant medical crises that ultimately resulted in him being hospitalized and placed in an induced coma because of the severity of his self-injurious behaviors that were were a product of severe pain that ultimately required extensive evaluation and was ultimately diagnosed with a cause. And that was incredibly disruptive to life in all shapes and forms for everyone, because it was the first time at 27 years old that he had been in a hospital setting because we could not safely manage his behaviors and safely manage him. And so that experience really caused us to have to stop, pause, reflect, in a way that we really hadn't, in terms of thinking about what were resources available, what were his needs, and what were the needs of us as a family, and tried to figure out what was the best scenario, or the least worst, the scenario moving forward. And so that process was one that I think a lot of families sometimes experience in adolescence. And so I kind of was going through this time course to sort of say, we got close, but we really didn't get there until adulthood. And so that was a different experience for us that really was in many ways transformative. Right now, he continues to live at home with my parents. He continues to have challenges, primarily now with self-injurious behavior, no longer aggressive behavior. And self-injurious behavior for him is usually head hitting and as a result of like painful stimuli that he's not able to express. And so we've been working with the medical team to try to mitigate these symptoms and mitigate these behaviors. But, we do still struggle with challenging behaviors. I think, though, ultimately what we had found was of all the options and resources available, a home-based program for him with his care team that's been involved in a lot of his care members have been involved in his care for over 10 years has been really essential. So this was actually after, post-medical crisis, post-ICU hospitalization, post-surgery. We go back to life and life continues and you carry some of these fears and worries, which I'm going to talk a little bit about in a minute, with you moving forward with a greater sense of awareness, especially as I myself am now an adult. I myself am now a doctor. I myself, work specifically with people on the autism spectrum and thinking about, challenging behaviors as they relate to GI symptoms. These are my areas of work and research, and you realize how hard it is, and in a whole nother way. It's not something that I didn't know, but you just have an even greater appreciation for the challenges and how life can throw you new challenges every day. So that was kind of the timeline I think that for me made sense to share. And again, I'm happy to elaborate on more specifics or more parts. But I really thought it was helpful to try to distill this into reflections and like key themes when I think about what is it like, or what is it the huge question of what is it like to be a sibling, especially now with someone with profound autism as an adult. And you guys might be, I'm sure, a lot of people very familiar with this poem of Welcome to Holland by Emily Pearl Kingsley. And I do love it. I think it's a wonderful representation. If you haven't had the chance, I'm just going to give you a moment to read it. I'll take a sip of water. In short, what it basically talks about is the parent's experience of you're planning this beautiful, wonderful trip to Italy. And you've got this imagining of what you want to do when you get there and all the places you want to see, the restaurants you want to go to. You have this dream. And then you find yourself in Holland. And Holland's a beautiful place, but it's not Italy. And this process of learning to appreciate the beauty in Holland, learning to grieve the loss of Italy, learning to have gratitude. And it really is, again, from this perspective of parent. I think this is a great way, though, to introduce the perspective of sibling. So when I think about this, I think about the fact that the child who is in Holland, and again, exploring this beautiful place of Holland, doesn't necessarily understand what Holland is and what Italy is. And as they grow and evolve, as they interact with other people, they start to recognize differences and they start to realize, they're talking about this place in Italy, but I'm seeing these places in Holland. Is there something wrong with Holland? Is there something better with Italy? Is there something I'm missing? And you go through this process of you're experiencing the world around you and you're trying to understand the descriptors of the world around you rather than an adult mind who can truly see these two parallel storylines or parallel universes. I think for the child mind, especially as a pediatrician, I can sort of say, like, the child mind is not that abstract. It doesn't understand at that level. And so it's a process. And so the best way that I kind of think about this is whether it's Holland or Italy, it's the only life I've ever known. And it's not until you get older that you really get to appreciate the complexities and how much it's currently, continuously evolving, because just as my brother is going through these multiple stages of life, I am going through these multiple stages of life. And I am developing through childhood, through adolescence, through puberty, through young adulthood, through professional life in a way that is parallel. Um, and so I think that that's from the perspective of sibling, it can be really, this type of topic is actually really difficult. I can say for myself, but I think for a lot of the people I've talked to, it's really hard to articulate because it is your life, it is your experience, it is your loved one. I don't really know what it would be like in any other way. So hopefully that gives some perspective or resonates perhaps if this is your experience as well. So, excuse me. I thought really long and hard, and again, had some difficulty with thinking about, how can I sum this up into some insights or reflections from what I've shared with you. And I think recognizing that this is just the tip of the iceberg, these were the things that I came up with. So I think first, understanding the sibling role is really complex, and I've hopefully highlighted some of that so far. That it's an evolving relationship because the two parties are evolving. My relationship with my brother as two children in our, school aged, 5 to 12 looks really different than when he was a baby and I was a toddler. Looks really different than when we are in our adolescence. Looks really different than when I was in college. Looks really different than now I'm a professional trying to establish an early career professional. The relationship evolves, as does every sibling relationship. I think there is just additional complexity in that. Um, one person's trajectory looks a little different than the other person's. And so figuring out how those continue to navigate and engage with each other, that dynamic is constantly evolving. Which brings me, I think, to the importance of family dynamics. I'm very close with my family, my nuclear family of like my two parents, my brother, and my sister. When we think about family dynamics, I do think it's also important to think about extended family dynamics as well. And for us, I actually don't have many relationships with some of our extended family, in part because of the dynamic and the relationships or failed relationships that they had with my brother. And so I think it's, when we think about the complexity of family and what that means, and the family also means chosen family. There are some people who have been in my life through the care of my brother since I was 5 years old. And I view them as, additional parental figures, people I go for advice. There's a whole different dynamic that's often created when you have someone who has profound behavioral and developmental needs. As a sibling, I also carry the role of caregiver and also carry the role of guardian, which I'm going to talk about in 6 in a little bit later. But finding that balance, especially when it came to talking to my parents about wanting to have some of those roles more formally, um, it again has to align with where the individual is as the sibling is at their developmental level and such. Um, Caregiving can look really different, and so caregiving from the role of like my how I've been able to be a caregiver at times has looked really different than, say, my sister. And I give the example of, I was a resident physician when my brother had his medical crisis. And so while all that was happening, I still was required to be in the hospital working and taking care of patients, and wasn't able to have like a leave to be with him. And so my sister was really hands-on and integral in that phase. And so I think we think about this often as like phases and the ways in which people can be present and provide care. And so the caregiving I gave in that phase often looked as more external emotional support to my sister, to my parents, because physically I just couldn't be in the home because I was physically at work. You might be familiar with the term the glass children. It's if not, it's basically a term that's often described when there is a child with significant needs, whether they be physical, developmental, neurologic, emotional, special needs, that the other unaffected sibling is perceived as glass or see-through. And that's because, the parents' attention and needs and focus have to be on the child with the higher level of need, therefore depleting the glass child of any individuality, of any supports, encouragement, things like that is often like how it's portrayed. It often has a kind of negative connotation, although I will say, some people are able to, experiences are all each their own. I, based off the connotations of this, have never really identified with the concept of a glass child. I think in the way in which I grew up, I was so integrated and enmeshed in so much of my brother's care that I felt really important and really valued. And so for what that looks like for me, was, even being a young child when he was doing ABA or doing OT or SLP, I was often tasked or included with, why don't you do this step? Why don't you model this? Why don't you ask him this? These are the ways you can support your brother when he's having a meltdown. And was received a lot of encouragement and praise and value of what I was able to contribute, in addition to also having my own spaces. But I think really feeling valuable from a very young age and feeling important when it came even to decision making at a young age of, well, how do you feel about this person coming into our home or not? Um, really negated, I think, a lot of the feelings that may be associated with like a glass child. I think with that being said, there is a profound emotional, psychological impact of just life in general, but a life when you have a sibling with significant behavioral needs, and especially as I shared, when dealing with disruptive behaviors and aggressive behaviors, I think a lot of that, the word complex doesn't really feel big enough, but it is, I think it's like this, the complex emotional spectrum of feeling hurt, feeling anger, feeling guilt, feeling frustration, feeling love, feeling sadness, feeling grief, grief for my brother, feeling, all of these things at the same time, and having to learn that all of these feelings are okay, and having then coping strategies to work with those feelings. Um, and that, I would say, in full honesty, is something that I continue to work with in my life. At every stage, are moments where I have to really go back to the roots of feelings are okay, and go back to that work. I think that it's particularly challenging when you think about from such a young age being a caregiver, and from such a young age feeling a responsibility, and from such a young age having to for me at times separate my brother as the person from the behaviors often again aimed towards me. That it's not him who's doing this, it's not, he doesn't want to hurt me, it's this, this is the behavior. um and so that, I think, is just lends itself to really having to learn and practice and work through complex feelings. I think communication and connection is a really important thing to highlight, because my sister, my brother, and I have a means of communication I kind of call like a language all of our own. We have such perspective and insight into each other, into our parents into us, and it's interesting to see how through life that translates to interactions with other people. Most of, especially when you're living with someone who has significant verbal communication challenges, you learn a lot about nonverbal communication. And it's profound the impact that has on how you experience the world around you and the people around you. And again, when it comes to thinking about like the evolving, individual that is the sibling, learning how to navigate that, learning how to navigate being in college or being in high school and being able to pick up on these cues that perhaps um, are more subtle to other individuals, that you're very tuned into this nonverbal communication. And so that also, I think, really lends itself to the advocacy piece, because even from a very young age, both my sister and I were very attuned to my brother and his needs. So oftentimes when there were challenges, it would be a conversation, parents and children, of what do we think is going on? We need to, my mom would sort of say, um, I need to pick your brain. What do you see? What do you think is going on? And it would be, again, I think it was an important part of incorporating us in his care and feeling important and valuable, in teaching advocacy from a young age. Because now, as adults, and now as physician, as guardian, as all these roles, it's oftentimes the same thing where it's, you know, presenting to his doctor, to his behavioralist, we're, dealing with this thing. I'm noticing these things. What do you think about this? I'm, really, I think this might be what's going on. I think we should pursue this, and having an advocacy in his life. It also has brought out advocacy in the world and like in the community experiences that we have. I have some really key sentinel memories of, unfortunately, like really unkind experiences while being very young. And so, whether it be someone, telling us like things like that shouldn't be let out of the house. And again, early 2000s, you're just like, oh, okay. As a child, having to learn how to navigate that, how to maintain composure at times, how to advocate, how to maintain safety, how to then, and this is more as an adult, how to then again allow space for the feeling of like how horrible that was to come up in a safe space. Um, and the advocacy piece can be often like the burnout prevention, but it also can at times be the burnout cause, where it's just, you see all the things that are inaccessible, on all the things that are unkind, and all the things that could be better. And it can feel overwhelming because you want all these things for your loved one and for people like your loved one, but trying to figure out how to actually facilitate it can be really overwhelming. And even in that space, like again, I always say in full disclosure, the reason I am a doctor is because I recognized that there were not enough doctors who understood um, autism and other neurodevelopmental disabilities. And so that was a way of advocacy in and of itself. So then I think, the other thing that reflection, when I think about especially the transition to adulthood, is thinking about the future. For me, guardianship was something that I first brought up when I turned 18. And again, we're 2 years apart. And it was really important for me at that time. I became very aware because again, you're turning 18, all of a sudden you're an adult, you're doing these things that again, it's always kind of funny. You're not really an adult, I think, ever. But you're aware as the adolescent and the young adult, oh, all these things are changing. And for me, paired with that was an awareness of, oh, the same thing is gonna happen to my brother in 2 years. But he is not in a place where he can protect himself financially at this stage, make medical decisions, live independently. And so that was something that was really, really important for me to express to my parents. And I did that independently. And when it ultimately came time to do the guardianship paperwork, after a lot of discussion, I think we sort of decided that it made the most sense, thinking longitudinally, to do a split generational guardianship. So I'm a co-guardian with my mother. And the reason we did this instead of it being my mother and my father was so that we wouldn't eventually have to change it to my sister and I, or my sister or I. And at the time, again, my sister is much younger, so she was not eligible to be a guardian at that time. But eventually, being that it would just be a shift from my mother and I to my sister and I. Which brings us to the great big unknown. I think is kind of the thing probably a lot of siblings, if you were to ask them, will tell you is like, yeah, I can't tell you what 5 years from now looks like. I can't tell you what 10 years looks like. And most people my age probably can't do that either. It's like your early career trying to figure these things out. But it's interesting because I think there's an extra layer of complexity. For me, I know that I will, depending obviously on how life goes, which are some things are out of our control, based off where things are now, maintaining my brother in a home-based program is the thing that's been the most successful and will, I presume, will be continue to be the most successful based off the resources available. And so it thinks about, for me, geographically, establishing myself nearby in Massachusetts. What does that look like down the road in terms of living arrangement? There's a lot of things that as a adult sibling you think about with a lot of uncertainty. What is going to be the future is, I think, can be the greatest anxiety trigger or fear trigger for a lot of people. And so that's where the coping comes in and is really important because it's very easy to go down the Pandora's box spiral of, oh my gosh, and then where will we live? And oh my gosh, how will we afford this? And oh my gosh, how will we, et cetera, et cetera, et cetera. And oftentimes that type of thinking is not super productive or helpful. And it's not the same as having a plan. And I think that's the part where I like to make the distinction. It's important to have the plan. It's important to have the power of attorney, the guardianship, whatever is appropriate, the even if it's not legal, just like having who are the support people, but not necessarily needing to have every single detail is okay because sometimes you just don't know what life is going to throw you and what's going to bring. I came across this proverb a long time ago, and it really resonates, I think, to my experience and my sister's. It's I am because we are, and it's this idea of I only exist as an individual here in time and space because of the lived experience and because of the people in that lived experience and because profoundly my brother and my parents and my sister. And while my sister and I would always say, like, if in a heartbeat we could take away this, any of the things that are causing, problems for him. So again, I usually talk about the communication. If I could give him a means of communication, would do it in a heartbeat. And recognizing that that would somehow radically change the lived experience and thus who I am. Um, and so I think it's this concept of, we become really enmeshed in the people in our lives. And I think, especially for siblings, it's a different type, oftentimes can be a different type of experience. I think along those same lines is forging a path as an individual is already hard, and it can be made harder when you try to think about the complexity of all this, of the logistics, of the emotions, of the different dynamics, in different family units and structures, and having some grace with that everyone has their own path and that it doesn't always need to look the same as your peers has been something that I have been learning. I think really actively, consciously thinking about caregiver fatigue early and putting up the protective measures, figuring out how to maintain, we can only pour, an empty cup cannot continue to pour. We only have 100% of, we can only, have 100%. There is no more, has been an important lesson in growing up that I think oftentimes, again, I'm experiencing and learning this perhaps earlier than most people might. I think it's often in different scenarios. And then I think, 9 and 10 kind of go together. Really finding your people, the people who support you, that nourish you, that allow you to again, just this is life. Get through your life as in any other situation, but that understand the nuance and the complexity, and the feelings and the sometimes challenges that are there. And that can look really different for different people. So some people have found, community groups to be really helpful. Some people have found, like online to be really helpful. I personally I have a very close, tight-knit group of people that a lot of them that I have found actually in older life, like in the last, few years, that I think for me was really important that they were able to acknowledge, accept, and give space for all aspects of myself, and not really try to pull things apart into different categories of just recognizing that my brother is an incredibly essential and important part of who I am in my life, and you can't really detangle that without losing parts of me. And so I think that finding those people who can respect that was really important. And who acknowledge and celebrate the milestones, big and small, that you couldn't share joy in things. Whether it be like we got a haircut, the little things can sometimes be really the most profound. So, tip of the iceberg. I just hopefully, like I said, this was a huge topic, huge ask, and I was struggling a little bit to think about what would be insightful and hopefully helpful. These are all, again, my experiences and my perspectives. Um, and there is no one right way to do this. And quite honestly, I don't think anyone ever really knows how they're doing things, or just like, oftentimes you just go with life, you go with the flow, and trying to develop the skills and tools and means to get through that with some grace. So with that, I would like to hand over to the Q&A.
Yeah, well, thank you so much. Thanks for that presentation. It's something we haven't been able to really cover before, and I appreciate you sharing your story and how candid and honest and open you are about all the experiences that you've had as a sibling. I'm a parent. We often hear parent stories, but we don't always get to hear from adult siblings. So it's really great to have your openness and
Well,
willingness.
I was excited to be able to have the opportunity, and then I was like, oh, that's a big question.
Yeah. So we have a lot of questions. So I'm going to start right in. Uh,
Yes, thank you
the
so
first one is, what advice do you have as someone who's been through this and you shared a little bit? What would be the most important advice you have for a young adult in high school who's dealing with an older sibling who's much like your brother,
much.
to try to have a really positive relationship in the future? Like, what's the biggest thing you could say that would make a
Yeah,
difference?
I apologize. I'm gonna have to blow my nose really quick, but
Oh, sure. Yeah.
the weather here is quite cold, so my sinuses are struggling a little. That is, it's a big question, and um, I think the thing that has been the most important and helpful thing that I personally have ever done that has allowed me to have not just a strong relationship with my brother, but with the rest of my family and with the people around me has been, quite honestly, therapy. And some form of means, like some way to create space to allow us to feel our feelings without judgment, to understand those feelings that then allow us to create really meaningful connection. And I think that that was really, I didn't start, that was not something I did in adolescence in school, or that was something I started actually in COVID, as I think a lot of people did. And did not expect in the slightest that the topics of what I would be dealing with or unpacking or going through would be at all related to family. I was like, I am here because I'm a doctor during COVID and this is horrible. And it was really profound and amazing to see subtly over time how my relationships became that much stronger, my communication became that much stronger, and it allowed me to deal with the complex emotions, because I think oftentimes we frame things as good emotions, bad emotions, and especially when it comes to a sibling, we often then say, I have guilt for feeling these bad emotions in this context. And that's often, at least it was my experience, was really harming me. And so being able to navigate this in a way where it's like any of these are emotions, you're allowed to feel them and you're allowed to sort of separate, I love this person and these behaviors are really challenging. And so it's okay for me to take space, time, energy, whatever to recoup. And that prevents the caregiver fatigue and it prevents the, it all feeds into itself. So that's a loaded question, but I would say some means of mindfulness, creating space. And again, for me, that personally has been through therapy.
That's good advice. Another question here is about, so you described taking on guardianship and that sort of thing. So, what are some resources people can use to learn more about that or what it's
Yeah.
like to be a power of attorney? Where could you point them? Is there a website you can go to, or do they really need to go and find a support group? What would be the best way to get that information?
So I will say I have a little bit of I have a lot actually, not a little bit, a lot of the privilege that I didn't have to do it alone. So I did it with my mom. And so that was a really important resource because she was able to say, we have now this attorney who specializes in guardianship paperwork, who is a real important guide. So I think in general, anytime you can do things with other people, it generally goes easier. It's generally a little bit better. Not always, but it is, can be. There's a lot of resources. I believe actually on the ARI toolboxes, I think you have some about guardianship and like power of attorney and legal documentation. There's some like if you search on Google, you'll pull up a lot of the toolboxes. A lot of the local community autism organizations have this. And I also think it's an important plug to put in here that not everyone needs guardianship or power of attorney, but they may need additional support. And so there are some other models that are out there to look into to think about like creating like your oftentimes they call mini boards is like one of the models I've seen where it's like who are the people that will help support you that but allow for the person to maintain their decision making autonomy. And so knowing what's available out there first and foremost, I think the web, second, the communities, and third, if you do need to move with legal interventions, like actually having some legal support is important because it's a lot of paperwork and it is not easy. And again, I sort of laugh, but I'm like, there was no way I was going to be able to figure that out at 18, but also like, or at that age, 20. But I can't even imagine how a parent would do it by themselves. It's just so much paperwork, and I have to do it every year. Every year we have to submit the paperwork for guardianship, resubmit some paperwork for the state of Massachusetts because my brother is on psychotropic medications. So there are like every year there's a lot of stuff to do, and you need a village, you need the support.
So, circling back to your question about, or your answer about therapy, do you think, I mean, I know this is impossible to answer because you're not a teenager, but do you think it would be worth considering starting that as a teenager? The person who submitted that asked.
Yeah, so that's a great question. I this is such an individual answer. I think having the conversation with the person is the most important. Does that person feel like it's something they would be willing to try or not? And again, recognizing that it's about finding a good fit and it's trying things. I, as an individual, had a really hard time in my early life with feeling like a lot of people were kind of giving me the answer of like, oh, things must just be so hard for you. And it really triggered an anger response in me personally. Well, you think it's hard for me. What about my poor brother? And like it felt really like dehumanizing to him and his experience and the fact that, I also get something positive from this person. It's not like he's a leech and sucking the life out of me. Like it was like that was the thing that I found to be really hard and so I was really resistant to a lot of the things like sibling groups, a lot of the therapy, because I was like, I don't really need other people's judgment on how I am coping or experiencing things. But that's again my teenage mind. It wasn't until, like I said, and I even went into therapy not with the intention of talking about my family or the family dynamic. It was something totally different. I was like, oh yeah, we don't need to talk about my childhood. We don't need to talk about like I just want to talk about COVID. And it's just funny how you realize where it's like, oh, okay, like you create a relationship with someone. This is a safe space to sort of be able to unpack. I actually feel really guilty when I go on vacation. I feel really guilty because he doesn't get to have the same exploration of the world that I do. And I feel really guilty that like my parents are not getting to go on this vacation. And you get to unpack that in a safe space where it's like that, and that's okay. There's no judgment with that. It's not the same as resentment. It's, I'm allowed to have this feeling. Um, and that's something I personally didn't was not able to do until adulthood. I was not able to do that in adolescence. And maybe I would have if I was in therapy, but I don't know.
So maybe a takeaway from that is if a parent has a sibling who's, say, 13 right now and going through puberty themselves, even if they're struggling now, doesn't necessarily mean at some point down the road they might be ready to learn more about it.
Exactly. I think that's the takeaway there is the siblings are growing up too. They're going through this crazy process of life just like we all are. And what happens in one moment is not necessarily reflective of what's going to happen for the rest of life. Siblings that don't have great relationships, it's not reflective of the fact that they may not have great relationships forever. One thing I didn't really talk a lot about is like my sister and I's relationship. So my sister and I are 7 years apart. For most of her childhood, I had a parental caregiving role to her. I did a lot of the parental things. And so there was a period of time where we had to figure out as adults how to be sisters and not parent child. And so that just whole navigating of different relationships of like my relationship with my sister is much, much, much closer now and different than it was a few years ago. And so I think just thinking about, how things are now is not indicative of how things will always be.
Really helpful insight. There are a couple of things here I want to note in the chat. So, a participant named Sophie shared some really helpful links about guardianship planning. So I will post those on the website too after the webinar so that people can access those. But there's some good advice there. So be sure to check that out. Anyone who's looking at the chat. There are some questions here that are more medical about gastroenterology and that sort of thing. Now, I know you're coming back in a few weeks. I'm
And
going to do more talks. So I'm
there.
going to encourage people to definitely come back and ask those questions at that webinar. I think that some of them may be answered with what you're going to say. And if you're unable to attend on those dates, we will be recording those talks. So I don't want to put you on the spot to kind of change hats right now. There are a couple more questions here about, do you have a couple more minutes? I know we're
Yeah,
almost.
yeah. No, I have a few more minutes.
I
I
just
can.
want to read a couple of these comments. One parent said that they have a 37-year-old who they just love. He has a great spirit and being there at times when his eyes, they can see how intelligent he is. They love him just the way he is, and they walk that fine line of accepting that, doing everything they can to help his body get everything that it needs every day and make him be his very best is a thing that they really find fulfilling in their lives, which I think is something that you were articulating as well. There's also this comment I want to read from Alice. She says, "This is just a comment, but I want to say that this has been informative and wonderful. My daughter is 45 with one older sibling and two younger siblings. I've attended many sessions on siblings and autism. This was by far the best. Many
Oh,
thanks." So I wanted to share that with you. I
yeah.
think you should hear that. A couple more really quick questions here. Um, have you and your sibling worked at all with your brother on employability? Is that something that's going to be part of his life?
That's a great question.
Yeah.
So where we are currently, we are still navigating some pretty significant medical issues. And so employability is not something that is on the table right now. And I think that's the part that I always emphasize is right now. Um, Things can change, and he's surprised me in so many ways. And so one of the stories I always sort of tell is like I always used to give one of these presentations that I talk about like, interoception and, how the body processes things. And I was like, my brother is not someone who can localize pain. And then the first time in his 29 years, he's 29 years old and he points to where he's having pain. And so this idea of things can evolve and change um, is really important. So my hope is that in the future, we can find a way, whether that be through employment or something similar type model to have daily engagement. Right now, he does a lot of community-based activities, but even that has had to take a step back because of the medical issues that have been going on. But my hope is that we'll be able to get to a place like that again in the future. Um, I think it's really important to think about like and again one of the things for me is has been like I don't think I could ever leave the state of Massachusetts, and I put that always, blanket statement, because you have to think about the community that you're in and also the resources that you have. And so the state resources that he has here are not things that are, and they were very difficult to get, are not things that are often accessible, especially when you think about aging out of the school system in other states. And so things like that, I think, are just other things that like the future planning that make life a little bit more complicated sometimes of just thinking about where even the employment, what part of Massachusetts. So are we going to stay in Western Mass, go to the city, things like that would all be involved in that too.
And that was another question people were asking about, like, how do you feel about being sort of, you're going to live in Massachusetts forever? And you've just answered it, like
Yeah.
you heard that. And it sounds like through some of the support that you unintentionally got during COVID, you've learned some ways to cope with that reality. Yeah.
Yeah, yeah. And I think, I mean, one of the things, if you're not familiar with how medical training works, is like there are some moments when, particularly when you're matching into residency or fellowship, that you don't actually get to choose where you go. And so those were profoundly stressful periods of my life. And I was very fortunate that I ended up in the programs that I wanted to in Massachusetts, but there were very real possibilities that I could be states away. My sister, which I didn't share, is actually crazy enough to be starting medical school now. So she is in medical school, very proud of her, but she's also experiencing and acknowledging that there are parts of our life that might take us away from where my brother is, and that's really challenging, but an understanding and desire to want to return. And so even my sister and I now as adults have conversations and we talk about, where would we live? Well, we collectively, the three of us, where would we live? Um, and that doesn't necessarily mean in the physical, like the same house, but the geographically, what does that mean? And where does that mean for us? And so I think one of the things that has been really a new experience is, again, my sister and I are both adults, being able to have these conversations at a level that we hadn't been able to do as younger, as a decade ago.
Right, right. And that speaks back to that. Just because it's one way when everyone's in their teens doesn't mean that it'll be like that forever.
Exactly.
Right.
My sister used to be like, I'm gonna go to, college in California. And she was like, no, 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 no. It's like, so things change,
Right, right. How someone feels when they're 15 may not be forever.
Exactly. Just like
Well,
for anyone, how we are in our,
that's
thank
very
goodness.
reassuring.
I
Yeah.
was gonna say, thank
Yeah.
goodness we're not the same as we were when we were teenagers.
Right, right. Well, we need to wrap up, but I wanted to read you one more kind note here. This says, thank you so much. I agree that this has been so informative. Thank you for being so real. You're an amazing sister to your brother.
Oh, thank you guys so much I really appreciated the opportunity to be here. I'm glad it resonated. Like I said, it was a big question and I was struggling a little bit of like, what should I talk about? But hopefully you'll be able to join on these other webinars that will be a little bit more my doctor hat. My sister hat never leaves, but more doctor forward.
Great. All right. Well, we'll see you in a few weeks.
Yeah. Thank you guys so much.
Take care. Have a great day.